And now to talk more on the pandemic treaty adopted by the World Health Assembly and its significant implications for Africa is the Executive Director of Resilience African Action Network Africa and the Global Policy Lead for African Pandemic Action Network, Aggrey Aluso, who is joining us via Zoom from Kenya. You're welcome, Aggrey.
Yeah.
Now, let's start with the words of Tedros Ghebreyesus, which indicate that the world is now safer. Is the world really safe with pandemic treaty?
Thank you very much, Nancy. I think Dr. Tedros could not be happier after 3 years of hard work trying to get this agreement, signed off. And I think what it means is that we have started a journey towards making the world safer. I don't think we are fully safer yet, but it's a very good first step towards making the world safer. The agreement provides a framework for cooperation, global cooperation, in dealing with pandemics, not just response, but prevention, preparedness, and response. And I think if you look at the finer details in the agreement, in as much as it's a compromise document, which means a lot of things that many interested parties wanted, particularly from Africa and other low and middle income countries, did not get them in terms of fully getting what they wanted. But I think it is a good step in the right direction, providing a framework for collaboration in terms of sharing technology, in terms of sharing knowledge, in terms of boosting our capabilities, providing framework that could help us boost our capacities to detect early and respond to threats of outbreak before they become deadly outbreaks. But I think a lot of work remains to be done in terms of implementing this going forward.
Now let's look at Africa. What are the significant implications of this treaty on the continent?
Thank you. Africa faced a lot of challenges during the past pandemics, and it's not just COVID. We've had Ebola before. We've had recently Mpox. We've had Marburg virus disease in Rwanda and Tanzania. There've been so many outbreaks in Africa, and Africa is in the front line of a lot of disease outbreaks, significant increases. And unfortunately, Africa does not have the level of preparedness that many other parts of the world have, particularly the global north countries. And this treaty, therefore, puts Africa in a good state in terms of creating a framework to collaborate globally, but also to collaborate regionally, and provide a framework for national preparedness, giving policy propositions that therefore, if we put in motion those propositions that have been stipulated in the agreement, Africa would be in the right direction to be prepared to prevent, respond, and contain outbreaks that are becoming more frequent than ever. And I think one of the most outstanding achievements from this agreement is, for example, I think One Health, which really directs action towards looking at the animal, environment, and human health sectors, more connected way than before, because we've seen a lot of outbreaks that we're dealing with are coming from the zoonotic sources, that means from animals, and we've not been planning our health response, so public health, with good, recognition of this interconnectedness. So this agreement really puts us in with that level of awareness and direct action that will help us now look at where these outbreaks are coming from in terms of the opportunities for spillovers. I think another great possible achievement, which is yet to be fully realized, is the pathogen access and benefit sharing, which means Africa has been having a lot of pathogens from its soil, from different parts of Africa, which are used to make countermeasures, vaccines, therapeutics and diagnostics. But we don't benefit from those pathogens. So one of the provisions that is in this agreement is that there's going to be an arrangement where if you get pathogens from a region like Africa, and a lot of pathogens come from Africa, then there should be an arrangement in which the countries that produce or that are source of those pathogens are going to benefit. That is in Article 12, pathogen access and benefit sharing, and that's going to be a very important provision. It's not fully realized. It's going to be negotiated as a protocol to that agreement, and it's one of the most significant pieces that Africa is really looking forward to benefit from, because it will help us now have access to the countermeasures that will help us respond to the challenges that we face.
Now, Agre, let me ask you, is it going to be all rosy? Are there anticipated challenges looking at the limited enforcement mechanisms, or don't you see?
Yeah, I think it will require a lot of political will domestically, and if we don't mash out that political will, we risk having the status quo remaining, and the status quo is one that does not help us in terms of being prepared for threats of diseases. So it's not going to be rosy. I think it's hard work ahead. All of us in our wholeness of society, the media, the research organizations like where I'm coming from, the scientists, we really have to rally together and impress upon our governments that this is just a statement of intention. The work now lies ahead, and we need to really mobilize resources locally, and Africa really needs to lead by putting resources where its mouth is, in terms of really putting human resource, financial resources, and infrastructural resources to really operationalize these intentions as have been stipulated in the agreement. A lot of stipulations are directional. It's advising countries to do what they need to do, and it's not providing resources from external sources to do that. So we will have to mobilize resources locally, and if that means we have to make tough choices about having to sacrifice certain interventions or certain priorities so that we can make our continent prepared.
On this front, actually, want to ask you how. Would you advise African leaders to leverage the opportunities the treaty brings, like focusing on domestic financing, localization, and local manufacturing?
Absolutely. I think we really have to leverage this opportunity, the goodwill that now the agreement presents to us. It really is urging for global cooperation on so many fronts, including technology. Technology and skills sharing, intellectual property transfers on mutually agreed terms. Countries can negotiate and agree on how to share intellectual properties that help us boost our capability to manufacture countermeasures locally. And it also provides for opportunities to, it stipulates provisions to help boost collaboration towards enhancing our research and development, which are all essential for enhancing our local production. And Africa at the moment really lags behind in terms of capability to produce essential countermeasures, vaccines, therapeutics, diagnostics. Locally, we really rely on external sources, and we saw how that ends up when we have a global crisis. Each country looks inwards and wants to take care of their populations. And therefore, the only way for Africa to be fully prepared is to have that capability to manufacture its own countermeasures. And these are opportunities to do that, yes.
Yeah, and this is wishing Africa well in this bid. Thank you, Agre Aluso.
Absolutely.
Thank you, Agre Aluso, for your thoughts.
Thank you for having me, Nancy.